Hello, I'm Dr. Whispers. I will be your plastic surgeon. Very well. So, you want to make some changes? You have a very beautiful face structure, actually. So, we need to do a consultation first. We're going to do a few measurements and try to determine what can we do with this beautiful face that you already had and enhance it a little bit more, okay? Let's start with a file for you. I already know your name. Beautiful name, to be honest. Okay, so the magic question. What brings you here today? What are your goals? Okay, working on something to be preventive and to enhance your beauty. Natural beauty, of course. Can definitely do that, especially with preventive plastic surgery. What would you like to change the most? Okay. Now, the next question might stir some feelings, but I want you to be honest with this. What bothers you the most when you look in the mirror that you want to change or that you want to prevent with plastic surgery? So there is some family history there. Okay. Yeah, actually, with plastic surgery is something that can be worked with. Very well. Yeah, it's all possible. Okay, when did you first start noticing it? Has it changed recently? Have you noticed that it's been going faster than usual, or it has been a slow process of the change that you're looking for? Okay. Yeah, I understand. All right, good. Let me just prepare myself here. I want to take a couple of measurements before we continue with the consultations, just to have it in our file. Do you have any issues with allergies? Not that you know of. Okay. Oh no, don't worry. We're gonna ask a few questions about it a little bit later on. We do need your full medical history. Okay. So let's start on this area here. We're gonna look through this area. Okay. I'm gonna get a little bit closer here. Good, 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 good. Very good. Let me write this down. Okay. Perfect. So it's a change that you have been noticing that is constant. A little bit slower, but constant, right? Okay, can you look to the side, please? Thank you. Like that. Okay. I might pinch you a little bit, but it doesn't hurt, okay? Good, very good. Thank you. Perfect. One more. Looking out this way. Okay, let me do it on this area here. Good, good, good. Oh, perfect. We're gonna look directly forward. Okay. Good. Good, thank you. There we go. Okay. I'm gonna do a few fine lines in your face with this. Then you can remove it in the bathroom right here. There are some wet tissues that you can remove it yourself. Okay, this is just for me to kind of mapping your face and seeing the structure while I do the question. This way it's gonna be easier for me to do the full consultation. Okay, so you might look in the mirror and see a bunch of weird scribbles and lines in your face, but don't worry, don't worry. Okay, yeah, it's like a mapping that allows me to see your face like a whole structure, see the area and where we can do changes. Don't worry, it's very easy to wipe. But I cannot remove it after we are done with the consultation because I do need to follow the lines. There we go. It's not bothersome? Okay, that's good, thank you. There we go. Okay. Now let me see. I'm gonna take a picture that I'm gonna upload to the computer. Okay, just need you to look straight forward while I do this. Fine. Good, thank you. Oh, actually, I missed a little line. Okay, let me just right here. There we go. It's better. Let's take another picture. The same. Good. Perfect. Okay. I'm sorry. Here you can see yourself in the phone. It does look odd. Some of my patients like to take little selfies about it. Okay, we have the measurements needed. Let me upload it. Yeah, I know, it looks very odd. Okay, so let's upload it to the system while we continue with the consultation. Okay, there we go. Those are the measurements that I needed. Let's continue. Overall of your face, what will you not want to be touched or changed at all? Are you looking for a subtle or more noticeable change? We have some patients that want the whole drastic change. They want to change it in just one pass. This is when it's more noticeable, that people can definitely know that something has changed with you. We have other patients that want to do it a little bit slower. That takes around, let's say, 5 sessions to complete the whole process of the change. What would you want to have your transformation be? Well, it's the same price between if you go with 5 or if you want a big one, but it depends because it does involve anesthesia and stuff like that. Some people don't want to go under for that long and prefer to go with just one run. continue with the questions. Do you have a specific reference photo or aesthetics in mind? Well, maybe, let's say we have people that bring pictures of actor or actresses or friends even that, oh, I want a nose just exactly like this one, or my eyes in this way, or the changes that have been done with this. You have it on your phone? Oh, okay. If you could just send it to me. Okay, I'm gonna get my phone close. Yeah, as many as you want. We're gonna put it in your file. Yeah, don't worry if it's too many. It all helps. Okay, thank you. Yeah, I got the pictures here. Let's see, this will be directly in your file. What will make you feel like the procedure was successful? Yeah, it's kind of like a trick question there. That you definitely, okay. Are there any particular facial features that you want to preserve? Kind of like, let's talk about other patients that they have a family structure, let's say a little nibble here in the chin that they want to preserve because all their family has it. Stuff like that. Maybe a mole, something. Okay. And are you considering surgery, non-surgical treatments, or both for this change? Have you ever had any consultation like this one before? First time, okay. Oh, you were recommended to us. Oh, thank you. By whom? Oh, yeah, I do remember her. Such a beautiful lady. Oh, thank you. You like her work. Oh, yeah, I feel really proud. Thank you so much. Okay. So we are going to talk now about specific areas. Let's start with your face. Now, which areas in your face in a specific are concerning you the most? Yeah, you told me overall, but let's talk specific about, let's say, oh, a little wrinkle here. There's a little something that I do in my nose that I don't like. You can be as detailed as you want. Okay. So we wanna be doing a change, but also to preserve and prevent. Very good. Okay. Are you mainly concerned about skin volume, wrinkles, sagging, or facial shape? Well, normally that will start looking, let's say by the end of your 30s, there might be start noticing these changes. It can be prevented, yes, with time, and it can be resolved too, also if it has already happened. That will be the case. Okay, good. Let's add that to your file. Are there any particular lines or wrinkles that bother you in your face? Let's say about facial expression, the way that you smile, or how your eyes look when you smile, or you frown too much. Yeah, since we're doing a preventive surgery, we need to know what details in a specific are the ones that are bothering you, that you are quote unquote afraid that is going to be a problem in the future. Yeah, definitely agree with that. Let me upload first the information here to the computer. We are going to do a face mapping with just a picture. And then when we are ready to go to stage 2, we are going to do a 3D modeling of your face and your body to do some more drastic changes with the computer on how you will look after surgery, exactly how you will look. Right now, with the picture that I took, I can do it for the facial features on how, let's see, it will work after we're finished with the question. But you can see in the screen right here in front of you, gonna upload the picture, and it has the lines that I was telling you about. But in a moment, when I finish loading the questions to the computer, it's gonna start changing. It's gonna make you look how it will look after the surgery, after we have done all the work that you want. Yeah, you might notice that it starts moving, some lines start disappearing, others start showing up. Okay. Now, do you notice these lines more when you are resting or when you're making the expressions? Okay. Are there areas that look different when you smile? Okay. How about when you frown? Yeah, this is going to be very helpful when we do phase 2, which is the 3D scanning, that we're going to be asking you to smile, frown, and do several other expressions on how your skin behaves. So it's a whole full mapping of your skin and how it expresses these emotions and how it moves. And it can actually predict how your face is going to look without the surgery or any enhancement, how it natural will be going. But again, it all depends also with genetics, with how we take care of our skin. If we're someone that enjoys the sun a little bit too much and maybe don't use protection, also the influences of how we eat, the things that we eat, or our water intake. It all depends, but it's gonna give you a whole new way on how to see, quote unquote, the future of your skin, your face, your body. For some people can be revealing, for others can be a struggle, but believe me, we're gonna help you with this. Do you feel that your face has lost any volume anywhere in your area? Okay. Do you feel like there is too much fullness anywhere? Are you concerned about symmetry? I always consider a face that is asymmetrical a beautiful face because it's unique. Yeah, that is personal preference. Are you concerned about your forehead area? How about the area between your eyebrows right here? How about crow's feet, which is the lines right here when we smile? Your cheek area? Okay. Now I do have to tell you about, there is this operation that removes the fat of this area. but what it does is just removes what I call the useful facial structure. When we remove it, we add a few years to the face. I do the procedure, but I do tell my clients that what will happen, especially if they tend to lose weight, because what they look right now without it, after they lost a little bit more of weight for whatever reason, is gonna be looking very different, because it's how the muscle in our faces gets the structure with the fat here. Okay. Very good. Let me add that information here. Have you ever noticed any changes in your neck area? About fine lines, anything like that? Sogginess? Concern about marionette lines, like the ones right here? How about under the eye hollows? Like right here in this area. That also changes when we remove the fat from the cheeks. How about your temples? It's also an area that can change quite drastically with that procedure. Okay. Do you feel like one side of your face looks extremely different to the other side? Okay. Are you concerned with bags under your eyes? Sometimes when you're very tired, it happens. Okay. Very good. Okay, that's the information for the face. Now we need to do some consultation for your medical history, okay? We need you to be as detailed as possible with this. Have you ever had any facial procedures before? How about any facial surgery? Okay. Have you ever had Botox or any neuromodular in your face? Okay. How about fillers in any place of your face, neck area? Okay. How about laser treatments? Chemical pills? Microneedling? Threads? Okay, with threads we are very careful because it's something that can go very wrong during plastic surgery on the face. So it's very important that aspect. Have you ever had any complication on any treatments before? So you have done mostly like face spa, like massages, but nothing directly injected to your face. Okay. Have you ever had unexpected reactions to any injections before? It could be on your face, your body. Have you ever been put under anesthesia before? Any problems with it? Have you had any problems with wound healing? Let's say you got a cut and it takes weeks and weeks and weeks for it to close up, to heal. It keeps bleeding. Okay. I think we can do the face scanning today. It's not the 3D one that needs to be done with the big machine that is actually booked up today, but I can do the full scanning of the face. I want to see in a moment. Okay. Have you ever developed any significant scars? Have you ever had a blood clot? How about excessive bleeding? Anything like that? Illnesses or infections? How about recent dental procedures? Okay, that's good information. Well, let me check if we can actually do it today. It will be very helpful. Yeah, you can already see in the picture, well, in the screen, how it's changing. Pretty magical. No, it's not the same as AI. You know, those programs that you look online, those apps that you download. No. No, this is a full computer program that is unique to our medical center that shows you the final end on how your surgery is gonna be. Yeah, we can do it. Okay, let me just page my nurse. Don't worry, it doesn't hurt or anything. You're gonna be laying down while we do the scanning. Yeah, that way we can be faster on phase 2, and we can give you the full results of the consultation on what we can do, how can we improve it, how it's gonna be looking, the final results. Yeah, but it's very important, the facial scanner that we're gonna be doing today. You just need to do a bunch of faces. Okay, I just paged my nurse to prepare the room for this. Well, we've done a couple of more questions. Okay, are you taking any medications right now? How about blood thinners? Any supplements, vitamins, anything like that? Okay. Don't worry about the brand, but if you remember. Okay. You told me you have no medical allergies, right? Do you smoke or vape? Anything like that? Had any recent changes in your health? Okay, good. Very good. So we are ready to go to the area. If you can join me in this place. Okay, are you comfortable in this position? Very good. So now for this, I need to remove the lines that I did before. Let's start with this. We're just gonna clean it up and remove it so a scanner can read your expressions. We're gonna be doing lots of them, so it's very important to measure them all. Very good. Sorry, it's a little bit cold, but it's what removes the lines that I scribbled earlier. Okay, now with this, you're gonna see the end result of what we can do on your face with the plastic surgery in our center. Very good. No, yeah, it's pretty cold. There we go. Okay, now, so we are gonna be using this scanner with a view of a blue light directly into your face. It's completely safe for the eyes, so there's no issues with it, okay? Now first I'm gonna ask you to do your regular face as you are right now, with no expressions, like a resting face. Yes. Okay, let me calibrate it for your account. So it's loaded there. Okay, we're gonna be scanning every part of your face like that. Good. Yeah, with the same expression. Good. That is all gonna be recorded into our computer program. Good. 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 Thank you. Now, the next ones might be a bit difficult because I need you to keep an expression for at least a minute, okay? Let's start with a smile. Just a regular smile, doesn't have to be big. Perfect, like that. Let's stay like that. Your face might twinkle a little bit. That is normal when the muscle is being used. And trying to scan it as fast as possible so you don't get tired. Good, keep it like that. Perfect, perfect. Very good. Good, good. Okay, we can relax now. The next one is gonna be a frown, like this, and also with your mouth, like you're sad, angry. Okay, we're gonna keep it like that too. Reading the fine lines, how your face reacts, how the muscles react. Very good. Good, 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 good. Very good. Thank you. You can rest for a bit. Now this one is sadness. Like you're very, very sad. Sometimes real sadness is very hard to scan, but we try our best because it's an emotion that, well, it's difficult to, well, imitate. Okay, good. I know this might be a little bit tiring for the muscles in the face. Perfect. Thank you. Now I'm gonna be asking you to talk a little bit. Whatever you want to tell me about. Maybe your last vacation. I need to measure and scan how your face moves, how your muscles move while you're talking. Okay, let's do a couple of minutes. Okay, yeah. Oh, that's interesting. Of course, very good. Okay, I need to be concentrated on the computer that is reading every face scan. You keep talking, whatever you want to tell me, whatever comes to your mind. You're doing it great. Very, very good. 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 Let's keep talking. Doing it great. Perfect. Okay, we can rest for a bit. Thank you. Okay, once we go back to the office, you're gonna see the magic on how this changes into what we're gonna be working on your face. Okay, I just need to scan a few other lines. Okay, I'm gonna be a little bit closer here. Okay, good, 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 very good, perfect. You're doing great. Very good. Yeah, it's like taking thousands and thousands of little tiny shots with this. How your face reacts. Micro movements that sometimes we don't register. But this one, this light sees it all. You can see every sign of expression in the face. Very good. Okay, that's it. Let me see if that is enough or we need to do more readings. Sometimes it tells us that we are 94% and we need to do another scanning. Okay, we are missing a few parts. Okay, I'm gonna pull your hair a little bit back, okay? Like that. Yeah, it's reading that we're missing a few lines in the forehead area. Okay. There we go. Very good. We are 100% now of reading of your face. This is for your face and neck area only, okay? Now we can go back to the office. Yeah, you can take a look in your mirror. Your lines are already clean. See you back in the office. Very good. So that was great. We got very great results. Now we have the full scanning. You can see it in the scan. Isn't it? It is a marvelous program. It works absolutely great. You can notice the changes, and I can make you smile, can make you frown. You see there? Now let's make another face here, and you see the difference. Very good. And here we go. Now with the scanning that we're going to be doing tomorrow, is going to be even more noticeable. It's going to show you a more detailed imaging, and we're going to be able to have the full program and procedure on what we can do. We're going to give you the pricing too. We can schedule it, we can give you dates, but that will be after the phase 2, if that's okay. Do you have any questions so far? Okay, so let's schedule you for phase 2. I have availability for it's mostly because of the machine. For Tuesday at midday. Do you have availability for that? Perfect. Now for this, I need you to come without any makeup, sunscreen, creams, or anything. Complete bare face. We are also going to be doing a full cleanup. This is because they're going to be lasers. scanning you. This is not gonna harm you or anything, but sometimes makeup can just not work with it. Okay. Any other questions? Well, it was my pleasure working with you, and I will see you in a week. Of course, please take care. Yeah, you can go directly with the nurse outside. She is going to give you the information for the appointment. Okay, and also a booklet on about what I was telling you, no makeup and stuff like that. Of course, take care. See you. Nurse, next patient, please. Thank you.